Hi, this is Joanne Hayes, nurse practitioner and director of the diabetes clinic at APD Primary Care. This is a video to update how to collect point of care A1C testing and urine microalbumins during primary care visits. So just to review, the urine microalbumin is a test that is one way to assess kidney function. It's a good early marker of kidney function, and patients who have diabetes that are at risk for having kidney disease. The test is normally done once yearly. We do it sometimes more frequently as well. The A1C test is a blood test, and it is showing us an average glucose for about a 3-month period. And it helps providers have a good understanding of general diabetes management. So to know which patients are due for these tests, you would be looking for patients that have a diagnosis of diabetes, and when they're coming in for an annual review, annual wellness visit, or their annual physical, you would be seeing if they're due for these, or if they're coming in for a regular follow-up visit. And sometimes it will say diabetes follow-up, sometimes it will just say follow-up, but they have diabetes as the reason that they're following up. So you have to do a little sleuthing, but you're mostly looking for patients with diabetes and if they're due for these tests, and the test should be done for that visit. The other way to look is you can look in health maintenance, and it might say that they're due, or it might say that they're due very soon. If they're due within the next couple of weeks, then you probably want to check in with the provider and see if they want it as well. Sometimes the A1C will be due less frequently if it's low or just by someone's diagnosis. It will say 6 months instead of 3 months here. And if that's the case, if someone's coming in at a 3-month mark, I would still get it if they're coming in for a diabetes visit, or you can check in with the provider. So the way you're going to order the microalbumin is you put microalbumin into the order screen here, and then you're going to choose this one here that says lab 546. And then in the order itself, you want to change it from lab connect to clinic collect and click normal. For ordering the POC A1C, it's the same thing. You'll put A1C in and order the point of care one, and then make sure that it says point of care here. You need to sign all the orders. And so in order to sign any orders, there has to be a diagnosis. So you want to choose a diagnosis that's already in place in the patient's chart. There's different ways to categorize diabetes, so just choose the one that's already on their problem list. And then under the ordering information, you want to put in per protocol. So let's just review specifically how to do the urine microalbumin testing. So it's easier to collect that test on the way to the room. So you'll have already assessed that they're due for it. So bring the supplies with you when you call the patient. Stop in the bathroom on the way to their room. You can just use a regular urine cup. It's not a clean catch, and you don't need a lot of urine at all. 0.1 milliliters can process the test. And then for the next steps for you on processing that order, once it's ordered, you'll go into your schedule and click on the visit orders, and then it will show whatever orders have been ordered for that particular visit. You will then click next to urine albumin creatinine ratio. You're going to print the label for urine albumin creatinine ratio. So this is the urine microalbumin test. It's a urine albumin creatinine ratio. There's different names for it. Just that makes it a little confusing, but this is what it's called. And then here you have to click on printing the labels. So each time the previous screen will lead to the next screen. And on this screen, you'll see that the test is there, the urine albumin creatinine ratio, and then you click on print labels. And then this is what is going to populate the information on the stickers. So the easiest way to populate that information is just to click here, which is collect all. And then the next screen that comes up will show you that it's populated the information. So it will put in whoever collected the sample, that it's APT primary care, the date, and the time. Will all be automatically populated when you click on that previous screen. And then once all that's done and input, then you're going to click accept. And then you'll store that to be picked up by the lab later. And then for the a1c testing, you're going to collect the a1c after the vitals and med review. And the reason is because the test can't sit around for long. So you want to get everything going and done in the flow, and then do the test as a last minute, the last thing you do. Then you'll run the test, and then you will post the results in the chart and let the provider know the test results. So when you, prior to getting the patient, you'll have all the supplies ready. Supplies are a lancet, the cartridge, alcohol swabs, a gauze, and a Band-Aid. And then forming the test, you'll clean the finger with an alcohol swab, let it dry, use a lancet to poke the side of the fingertip, wiping the first drop of blood away, and then use the sample collection device to collect the blood sample. And the sample needs to be processed within 1 minute of collecting. And then you're going to process the sample in the adult lab, room 58, in the a1c machine. And then there's a training through Elsevier showing you exactly how to use this machine. And then you have to input these results as well. So just like in the microalbumin, you'll go to visit orders, and then you're going to click on the POC a1c test and click on enter results. This is the screen that pops up next, and it's where you input the results from the testing. So each of the areas that are marked by red, you have to fill out. So you'll put in your name next to technician, you'll put in the collection date and the collection time, and then the result date, and then down here, the result date and time. And then you'll click accept, and that will upload the information into the chart. And that's pretty much it for collecting those 2 tests. And we really appreciate all your help. And if you have any questions, please ask us. Thanks a lot.